Hi everyone, welcome back to your channel ilovepharmacology. In this session, let us understand one of the new drugs which has been introduced into the market, that is Vonoprazan, which is a novel proton pump inhibitor. So, learning objective, you need to understand the mechanism of action of Vonoprazan. So, what are the advantages of Vonoprazan over the existing proton pump inhibitor and their uses as well as the side effects. So what are potassium competitive acid blockers? So usually vonoprazan is nothing but it is a potassium competitive acid blockers. So it is also called as PCAB, that is potassium competitive acid blockers. So mechanism of action of vonoprazan is it competitively inhibits the action at the potassium binding site. So it is a competitive inhibitor at the potassium binding site of the hydrogen potassium ATPase, which is present in the gastric parietal cell. So thereby, by binding to the potassium site on the H plus K plus ATPase, it reversibly inhibits the H plus K plus ATPase in the gastric parietal cells. So vonoprazan being a newer proton pump inhibitor, it has got a different or the interesting mechanism of action, that is it is a potassium competitive acid blocker and its blocking activity is reversible in nature. So it blocks the acid secretion more rapidly and it is longer acting than the proton pump inhibitor which are existing in the market. So one word you should remember about vonoprazan is it is a newer drug. It binds to the potassium site on the H plus K plus ATPase in the gastric parietal cells and they reversibly block the potassium binding site. So it is a potassium competitive acid blockers. It's one of the newer class of acid suppressing drugs which has got more advantages. Unlike the proton pump inhibitor, it does not require any gastric acid for activation and it has got faster onset of action. So this is the advantage of vonoprazan. So it does not require a gastric acid to get activated and it also has got the faster onset of action. So for proton pump inhibitors to act, it required a presence of the gastric acid. So coming to the advantage of the vonoprazan over proton pump inhibitor, vonoprazan has got rapid and strong acid suppression action. It is stable in acidic pH. It does not require any gastric acid to get activated. It works independent of the CYP2C19 metabolism. Whereas in case of omeprazole has been involved with many of the drug interactions. Coming to the indications of vonoprazan, it is indicated mainly in the GERD cases, peptic ulcer disease, H. pylori eradication as a last resort. If none of the H. pylori medications are working out, you can try out the vonoprazan in combination therapy, and also it has been used as an investigational drug in the Zollinger-Ellison syndrome. So what would be the adverse effects of vonoprazan? So commonly it can cause diarrhea, constipation and abdominal pain, but long-term use can lead to some of the electrolyte deficiencies, like it can cause hypopygmia and also it can cause gastric hyperplasia because of the prolonged usage. So when we talk about the dosage, usually for GRD it is given at 20 milligram once a daily. For H. pylori infection, usually the dose will be 20 milligram once or twice daily as a part of triple therapy. So please remember, vonoprazan based regimen has got the high eradication rates in triple therapy when it is used with amoxicillin clarithromycin or as a dual therapy with high doses of amoxicillin. However, their effectiveness is dependent on the clarithromycin resistance. So we need to know about the clarithromycin resistance so that vonoprazan can function more effectively. So this was all about the vonoprazan. So in summary, vonoprazan is it's a PCAB, potassium competitive acid blocker. It has got more advantage than the proton pump inhibitor, like it is more faster in onset of action. It has got rapid acid suppressing activity. It is very long acting, more than 24 hours to it can act till 48 hours, and it can reach a steady state up to 7 days, and it requires once daily administration, lesser doses 20 milligram, and it is having a higher efficacy in terms of eradicating the H. pylori in combination with triple therapy or in combination with dual therapy. Thank you.